we're joined today with Dr. Dan Epshtein. Kind of wanted to talk about medical optometry. There's a lot going on right now.
So even in the few years that we've been out, there's been a lot of new things coming out. What do you think you're most excited about that's been out maybe in the last year?
Yeah, so for me, it's been really neat in the last couple of years to start hearing about not only the equipment, but the pharmaceutical side, because we've had a lot of new innovations there. And you see it in dry eye, you see it in glaucoma, but to me, the glaucoma one is really kind of exciting because for so long it'd been somewhat stagnant. And now we're starting to see different classes, different ways to utilize the drugs, things like that. How about you?
Yeah, that 100%. So with new rho kinase inhibitors, with Rhopressa being approved like about last year, now just new is the Rocklatan drug. That's going to be, I think, a big game changer because we haven't had a new QD drug in a long time other than Rhopressa. So especially for me, from the compliance standpoint, that's how I've been getting a lot of these medications switched out from, let's say, like COSOP, BID, going over to Rhopressa. And I found great, not only safety profile, but also fantastic IOP drop in these patients.
Yeah, I think you and I would both agree compliance is much higher when it's a once a day dosage because people forget their drops if it's twice a day and they don't bring them with them or they don't remember, especially if you get up to 3 times a day. I mean, you're almost never hitting that. So for me, being able to supplement with a QD drug has been really beneficial for those patients that are already fairly well controlled but need that extra little bump. Beyond that, I'm excited to see how Rocklatan does because it's taking a true prostaglandin, combining it with that extra, benefit of Rhopressa, and then keeping it at once a day dosing. So the studies are looking really promising. I think it's going to be exciting to see.
Yeah, I think it's going to be an amazing new therapeutic agent for all of us because ideally we want our patients well controlled on just hopefully one drop once a day, which a big chunk of our patients on latanoprost or Lumigan once a day. If we can give them even more of an IOP drop, but again, just QD, no other problems, it'd be great.
Yeah, it would be. And I've seen a lot of fight from the companies behind these drugs to get coverage expanded. I think that's really great. Vyzulta's done a lot with their coverage recently, utilizing a different way with the nitrous oxide and making the outflow a little bit better. And I think a lot of clinicians kind of struggle with figuring out where to put that in their, in their drawing of which drug they're reaching for. Especially new graduates, I think, are the perfect demographic to start utilizing these things because we're not quite so indoctrinated in what we've done for the last 20 years.
Yeah, I think for us, we've learned about everything, but we don't have our own habits set yet. So a lot of us may be turning to the new medications that are coming out because everything's really new to us. This is the first time we're really pulling the trigger on our own, making all those decisions.
Yeah, absolutely. And, beyond pharmaceuticals, technology is changing like crazy. And I think what better generation than ours to get on board with that, right? We love anything new. What would you say has been, your most exciting with technology?
I think the biggest change that I'm really excited about is OCTA. So OCT angiography is a huge thing. I've been using it quite a bit in my practice, and I use it from everything with optic nerve disease, whether it's glaucoma or ischemic optic neuropathy, and then of course all my diabetics. I have a pretty big sickle cell population. I've been using it in those patients. And just like with any technology, it takes a little bit of time to integrate it, but little by little you learn what technology is, you learn where its uses are, and it's still very early on in sort of the process of learning, but I think give it a few more years and OCTA is going to be just as popular as RNFL scans and macular scans. Everyone's going to be doing it.
I mean, when GCC analysis came out, people didn't really know how to utilize that well, but they knew that it was an extra step that would identify problems earlier, and then they figured out where to use those data points, right? So now we have OCTA. We can start drawing off of that for so many diseases, not just glaucoma. And beyond that, you have companies like Zeiss who are putting together an entire suite of technology that allows us to interpret and follow these patients and pass off care from one doctor to another without losing anything in translation. You can take your Claris photo and your OCTA and everything else and put it together and really know exactly where that patient is.
Yeah, I think the issue with technology sometimes is we have so much data coming in now, and it's hard to go through it all. When you have a patient sitting in front of you, you might only have a minute or two to really go through all the data. And integrated diagnostics, or in something like a retina form or a glaucoma form that Zeiss platform has, it's great because it puts all the information on very easy sort of way to visualize it, a lot of nice charts and numbers come up very easily. And the most important part is you're looking at structure and function very easily as opposed to having 10 different papers printed out sometimes, which is a little bit tough.
What would you say to those colleagues of ours who maybe aren't quite as eager or are ready to jump into new technology like OCT-A? How do they get comfortable with that and utilize it in their practice?
I think the best way is, one, speak to a colleague that might have it already, or number two, at these conferences, the technology is right there. You can take a look at it, and a lot of times, someone else might be at the booth like, oh yeah, I just got that last month. They might be asking questions, you can listen in on it. And a lot of these new booth talks, which I'm a really big fan of, is that you have the experts right there, literally 2 feet away from you. So you can ask, hey, can you look at this OCT for me? What do you think? And you sort of talk it through.
Yeah, absolutely. I think coming to the shows is important. Play with it, ask questions, don't be afraid, and just jump in, right?
Yep, 100%.
Awesome. Well, I guess we'll see what comes down the pipeline, but it's an exciting time for sure.
Yeah, 100%. There's a lot of new things coming out, and every day is going to be a new topic out there for us to talk about.